All right, welcome everybody to the Implementation Toolkit for Small Sick Newborn Care webinar. Welcome. Today's topic is on where is the power for newborn units. Please introduce yourself in the chat. Next slide, please. Once again, welcome to the Implementation Learning Seminar Series. My name is Dr. Mbozo Sipalo. I'm one of the co-leads of the Newborn Toolkit, primarily focused on the English-speaking audience. Welcome to our Newborn Toolkit learning community. The aim of this series is to encourage collaborative learning for faster progress together for small and sick newborn care. Today's topic is a really exciting and pertinent one. Where is the power? What are the solutions for small and sick newborn care in the context of power outages? Just to let you guys know, in 2023, the Newborn Toolkit had over 28,000 users from more than 170 countries. And this is a growing community of users. And we very much are happy that this continues growing. And to join the Newborn Toolkit and to hear about webinars, news, and share tools or ideas, please sign up to our Toolkit newsletter. Below, you'll find QR codes in English, and we have a Newborn Toolkit newsletter in French. And please do follow us on Twitter, LinkedIn, and Facebook. Next slide, please. All right, so today's topic once more is where is the power? What are the solutions for small and sick newborn care in the context of power outages, hosted by the Newborn Toolkit. We have exciting upcoming events. The next event that we have is on 18th June, and it's our French to English webinar, and it'll focus on humanitarian crises for the most vulnerable newborns. On 30th July, we have yet another exciting webinar focusing on neonatal nursing. So what's next for global neonatal nurses, workforce, governance, and qualifications in low and middle income contexts. And on 6th August, in time for World Breastfeeding Week, we have our webinar focused on why does breast milk matter even more for the most vulnerable babies. Welcome, please introduce yourself in the chat. I'll now hand over to Lauren. And next slide, please.
Thank you, Mbozo. Alors, bonjour et bienvenue à le webinaire où le pouvoir et quelles sont les solutions pour les soins aux nouveau-nés malades et de petite taille en cas de panne d'électricité. Si tu veux écouter le webinaire en français, s'il vous plaît, cliquez sur le chaîne français affiché en bas de l'écran. Et on a aussi quelques événements à venir. Le 18 juin, on a la santé des nouveau-nés dans les crises humanitaires. Et le 30 juillet, on a un autre webinaire qui se concentre sur les ressources humaines, la gouvernance et les qualifications dans les pays à faible et moyen revenu pour les infirmières néonatales. Alors, next slide. So I'm very excited to introduce our host for today. So Millicent Alou, she is an award-winning biomedical engineer, the Regional Director of Biomedical Engineers and Technologist Implementation for NEST 360. She serves as the Honorary Secretary General for the Association of Medical Engineering of Kenya and a member of the Global Clinical Engineering Alliance. She is a strategic advisory member of the Medical Devices at WHO and a Medical Devices Policy Review Committee member at the Kenya Bureau of Standards. So very accomplished, and we are very excited to have her here today to host this webinar. I will pass it over to her.
Thank you so much, Lauren. And once again, welcome to today's webinar. Next slide, please. Yes, so today's webinar, as earlier been introduced, is about waste power, and I'll be giving us an overview of the effects of power outages and fluctuations and what some of the solutions that are available, some of the low-hanging fruits that you can actually use across our different countries to ensure that we have power and even to survive in these power outage areas. Next slide, please. So next slide. So we'll be having different speakers today, but I'll start by giving us an overview of the effects of power outages and fluctuation. So one of the things that I believe all of us are aware of is that electricity is needed to power the most basic services in our healthcare facilities, starting from lighting to medical devices and even to communication and even to provision of clean water supply. And reliable power is also crucial for the medical equipment that we use in all the departments, including the newborn unit. Reliable energy provision is one of the enabler of the universal health coverage, which is our goal for all of us to achieve. Unfortunately, there's a very sharp urban-rural divide, whereby we find the urban healthcare facilities often report more access to electricity and more reliable electricity than the rural facilities in the same country. Next slide. I'll take us through one of the publications that was done by WHO in the year 2023, a research that was carried between the year 2015 to 2022 and published in 2023. And it was indicating that there's a number of population that has no access to power or to electricity. And there's also quite a large population globally that has unreliable access to electricity. If you look at this data, you will see that 470 million in sub-Saharan Africa have access to unreliable power, meaning that at any given time, we have these people either having power fluctuation or in complete darkness, or having power that is not able to drive the medical devices in the healthcare facilities. 171 million in sub-Saharan Africa have no access to power completely. So this brings us to a question whereby we ask, how do they support the medical devices, and how do they support the healthcare services without power, with no access to power completely? And looking at it, 237 million in South Asia also has no access to power completely. So averagely, if you look at this, about 920 million globally do not have access to power or are having power which is very unreliable. Next slide, please. Now, with that particular data that I've just shared, you will realize that about 1 billion people worldwide are estimated to be served by healthcare facilities with no electricity access or with unreliable electricity supply. And what does this mean? This means that a number of times we have people going to the health facilities and they don't get services because there is no power. Or they get to the health facilities, they are connected in various devices for treatment, but then unfortunately they pass on because the devices fail due to lack of power. So there's quite really a lot that needs to be done. And this is a call to action to each and everyone who is listening to me today, that we have an action to do to ensure that our health facilities have power and our a number of population that we are serving get access to power. From the data that I shared in the last slide, it shows that 12% of healthcare facilities lack access to electricity in South Asia, 12%. And coming to sub-Saharan Africa, 15% lack access to any electricity at all. And only 50% of hospitals in sub-Saharan Africa report reliable electricity access. So this leaves us with a situation whereby we do not give service provision to the population that we are supposed to serve, just because we do not have power. Next slide, please. So Nest 360 is one of the programs that has really taken this particular item very seriously and has a nested dashboard that is able to monitor and show the power outages across the facilities where they operate in. As you can see this particular bar chart, you will realize that every single month, we are having a number of facilities having power outage. And if you look at this, you will see it's just a little bit above 50% of the, about 50% of the facilities are having power outage every single month. That means every day we have a power outage. It could be 1 hour, it could be 2 hours, it could be 30 minutes, it could be a whole day. But at the end of the day, it's very unreliable to have a power that is not stable to support the devices. Because as we are all aware, the medical devices do not all have the battery backup system that can support them for a given period of time for treatment. And so the moment we have any power cut or any power outage, then that particular service is interrupted at that time. And so if you look at this data that is provided by Nest 360, this is a clear indication that this is a very big problem in sub-Saharan Africa and all those other areas that were shown by WHO in regards to power supply. Next slide, please. So yes, we have quite a number of solutions that have come up. And today, in our webinar today, we are going to look at a few of the solutions. We have the use of solar panels. We are going to have one of our panelists taking us through the solar panel as a means of alternative power supply. We also have the use of generator backup. One of us is also going to take us through the use of generator backup as a means of power supply or alternative power supply. And after this, we're also going to hear from one of us taking us through the Hadley monitoring system, which is able to monitor the real-time delivery of power and is able to show us whenever there's any power fluctuation, and we're able to record. With all this, we're actually able to use this particular data from Hadley system to advocate for any alternatives power supply that is available or that is feasible in our various countries. Next slide, please. And so with that particular overview and introduction, allow me to introduce to us our next speaker, Mr. Padri Kasley, who is going to take us through the solar. So Padri Kasley is an adjunct faculty member in the Department of Electrical and Computer Engineering at the University of Washington. From the year 2020 to the year 2023, he served as a design studio coordinator at the University of Ibadan in Nigeria, where he established a solar-powered engineering prototyping facility. Padri's work focuses on technology, global health, and climate change mitigation and adaptation. Allow me to welcome Padri to take us through how we can have an alternative power supply in our facilities. Welcome, Padri. Thank you.
Hi, thank you very much, Millicent. Yes, happy to be here. Yeah, so I'll just briefly talk about using solar panels for newborn units. I'm going to first talk about a little bit about the science of producing electricity using solar energy. Then I'll talk about the components of a solar electrical system. And then I'll briefly mention why solar systems are important, and I'll give some resources about how to finance solar electricity systems. So there are two ways to generate electricity using solar energy. One is called solar photovoltaic electricity, and the other one is solar thermal electricity. Solar thermal electricity generates electricity by heating up a liquid and to generate steam, and that steam spins a turbine to produce electricity. But for the purpose of today's talk, I'll be talking about solar photovoltaic electricity, or solar PV electricity, which is the generation of electricity from a material which reacts with sunlight to produce current. Next slide, please. So just briefly, a little bit about the science about how solar cells work. So Solar cells, which is a functional unit of a solar panel, they're made from an element called silicon. Silicon is, I believe, the very abundant element here on Earth. And it's a special type of material called a semiconductor, which means that it has properties of both conductor and insulator, and it can be modified to harness some of its special properties. Next slide. And so this silicon element can be modified into two different layers and sandwiched between two conductive materials. One layer is called the N-type silicon, which is negatively charged. And there's also a P-type silicon layer which is positively charged. And so this modified silicon gets pressed together, and in between these two layers is a junction, which has an electrical field. Next slide. And so when a particle of light from the sun strikes the silicon layer, it dislodges an electron. And this electron is able to move freely within the material, and it creates an electron hole. And so this electron, because it is a charged particle and because it exists within an electrical field, it will be forced to that conductive layer at the top of this diagram here. And it will move through a conductive material, and it will try to basically reconnect with the electron hole which was produced. And so it will do this by moving through a circuit. And as it moves through the circuit, it produces electrical work. And so this work can charge a battery or recharge a battery, or it can power your electrical equipment like light bulbs or air conditioners or any number of medical devices. Next slide. And so these are the functional components of a solar photovoltaic system. First, you have your solar panels, which are actually generating electricity. These panels will have to be connected to a solar charge controller. These are a special type of electronic device which manages power to the batteries. Additionally, you'll have the batteries inside your system, which will store electricity. And then these batteries generate direct current or DC power. And all the types of medical equipment that are found in a pediatric unit, they run on AC power. And so you also need to have what's called an inverter to change that DC power into AC or alternating current, so that your computers, your air conditioners, your radiant warmers and infusion pumps, they can be powered. And so the inverter is an essential element of a solar PV system. Next slide. These systems, they can be standalone or off-grid, which means that they are not connected to the utility or grid system, or they can be hybrid or grid-tied systems. So in grid-tied systems, the electricity can also be sourced from the utility, and this electricity can be used to power the loads, the electrical equipment within a pediatric ward when there is no solar electricity generation, and it can be used to recharge the batteries as well. Next slide, please. And so on a sunny day, for example, when there is a lot of solar power being generated by the solar panels, if there is excess power, then a pediatric unit would not need to rely on grid energy, and the solar panels can provide enough electricity to power a pediatric unit, and any excess power generated can be used to recharge the batteries. Next slide, please. If it's a cloudy day, for example, and the amount of electricity produced by the solar panels does not adequately meet the power needed to run the electrical equipment within a pediatric ward, then the energy will be sourced from the solar panels, and any additional energy needs will be met by the utility grid. Next slide, please. But as we know, the sun is not shining all the time. So during very cloudy days or rainy weather or at night, when no power is being generated by the solar panels, it will have to be sourced from the grid in these hybrid systems. And so when there's no solar power, the grid electricity powers the electrical devices and is used to recharge the batteries. Next slide, please. But as we know, oftentimes grid power is unavailable as well. And when this occurs during rainy days or at nighttime, then pediatric units will have to rely on battery power to power the electrical devices within a pediatric unit. You can actually have battery backup systems or electrical systems that do not rely on solar panels to power electrical devices within a pediatric unit. And in this situation, the batteries will provide power to the electrical devices within a health facility. But if a good rule of thumb is if your health facility is experiencing power outages longer than 6 to 8 hours, then you should really consider a solar panel solution, incorporating solar panels into your electrical system in order to recharge the batteries and provide power when grid power is unavailable. Next slide, please. And so there are many benefits of having solar PV systems. First of all, if your solar panels produce enough electricity whereby you are generating more power than is consumed by the electrical devices, that gives your facility energy independence, which means that you are more resilient to power disruptions. I just read in the news yesterday that the entire national grid in Nigeria is down because of industrial actions by the workers at the electrical grid. And so if a health facility is able to produce more electricity through their solar solutions than is required, then that gives them energy independence. Furthermore, solar PV systems are suitable for, especially in locations where there is no electricity access. So in rural health facilities are particularly suitable for solar PV systems. And a benefit of this type of system is that there are no recurring electricity or fuel costs. I believe that the cost of fuel has risen 5-fold over the last 3 years in the country of Nigeria, where I most recently worked. And so these price shocks can be very disruptive to managing a budget at a health facility. And having independent solar or electricity generation can make you more resilient to when there are disruptions to electrical systems. And so, there's a increasing risk of natural disasters, which can knock out electricity systems. And so having electricity produced and stored locally really creates a lot more resiliency in electrical systems. And then another major benefit of such systems is that no greenhouse gases are emitted, which warm the atmosphere, and there are no particulate matter which are produced from the burning of fossil fuels. And so that reduces air pollutants as well. Next slide, please. And so when you are working with suppliers who provide energy solutions for your facility, you may have to make a decision about what type of energy storage solutions to consider. So there are two major types of battery systems. There's lithium-ion batteries as well as lead-acid batteries. And the guidance from the World Health Organization is that health facilities should either select lithium-ion batteries for their energy storage solutions or should design energy storage solutions which can incorporate lithium-ion battery technology in the future. And so there are many benefits to lithium-ion technology. They have a smaller volume, a longer lifespan. Lithium-ion batteries can last 10 years or longer and require little to no maintenance. One drawback is that there's a higher upfront cost, but over the lifetime of the battery, it can actually be at the same cost as a lead-acid solution. So lead-acid batteries are larger physical volume. They may last only 3 years, which means that they need to be replaced frequently and they require regular maintenance. Next slide, please. And so solar PV systems, they're a clean fuel source. So I believe a paper out of Harvard within the last couple of years attributed 10.2 million premature deaths annually to the toxins released by the burning of fossil fuels. And so these particularly affect children under the age of 5 or developing fetuses because they are particularly susceptible to air pollutants as they are developing. Next slide, please. And so solar PV systems, they also do not emit any greenhouse gases. And so between 2030 and 2050, climate change, which is caused by rising concentrations of greenhouse gases from the burning of fossil fuels, can cause, or is expected to cause 250,000 additional deaths per year from undernutrition, malaria, diarrhea, as well as heat stress. And so this will particularly affect those who are not born or young people today. Next slide, please. And so if you're looking to finance your solar solution, most major sources of finance will flow through your national government or your regional development banks. There's a large, I believe it's $51 billion fund from the UN called the Green Climate Fund. And this fund, it goes towards supporting clean energy solutions in low and middle income countries. But these types of funds are not likely available to support small like hospital systems of one or multiple health facilities. But there is some funding available. You can work with NGOs and bilateral funders, as well as the UN Development Project has a small grants program called the funded by the Global Environmental Facility, as well as there is a UN Capital Development Fund, which works with primary and local governments. Next slide, please. So if you'd like to learn more, there's a great technical document by the WHO called Accelerating Access to Electricity in Healthcare Facilities. And the UNDP has some wonderful literature as well. You can check out their Solar for Health initiative. All right, thank you very much.
Thank you so much, Patrick, and for that wonderful presentation. Allow me to introduce our next speaker, who is Evelyn Zimba. She's going to take us through how to improve availability and use of backup generator, example from Malawi. So Evelyn Zimba is a nurse midwife with an MSc in pediatric nursing and master's in public health. She boasts of over 20 years of experience in maternal, newborn, and child health, MNCH. Currently, she's the Malawi Country Director for Newborn Essential Solutions and Technologies, that is NEST 360. She is overseeing program management and serving as the primary representative for Nest 360 in Malawi. Welcome, Evelyn. Thank you.
Thank you, Millicent. Good morning, good afternoon. So I'll be sharing experiences for Malawi in terms of power backup system in the nursery unit. But before I talk about the nursery units, I would like to share a brief background in terms of the electricity supply in Malawi. In Malawi, the national grid is supplied through hydroelectric power, but the capacity of the national grid cannot meet the demands of the country to cover 24/7. And having a backup power is a must. But in the recent years, Malawi has been repeatedly struck by cyclones and storms. This made the situation even much worse. As a country, it had to do road shading to ensure at least they were able to share the little power that was available. So when we were introducing NEST program in Malawi, we started with a baseline assessment. During the baseline assessment, we discovered that out of the 37 facilities that we are supporting, 31 are the ones which had at least a backup power, which was at least including the nursery. In some of the facilities, you would find that they have backup power, but they had selected units where they were using that backup power. So it would be the theater or the neighborhood. But then now, since there were these few facilities where the nursery did not have backup power, as a NEST program, we also had an intervention that we were doing in terms of health facility readiness assessment. So we are visiting all the facilities with a checklist to see the basic things which we wanted them to have before we could install NEST equipment. So it included a number of things like water supply, and one of them was also the backup power. This provided at least an opportunity to discuss with the management on the need to ensure they had backup power for the nursery, because that guaranteed them for us to install NEST at their facility. And I'm happy now that all of them have now a backup power at the facilities. So here we are talking a backup power that they have a genset and maybe they have solar. But now having that backup power functional all the time when there's a power outage is also another issue, because we are having challenges of fuel, even maintenance of the equipment, as well as usually the solar capacity also is not of that standard. But we will find that the power will last not long, and some of the equipment will also not be powered by the solar. So this is a big problem in Malawi. Next slide, please. So luckily enough, as a program, after seeing this challenge that we are facing, we started now assessing, monitoring the power outages. So we are monitoring the power outages in several ways. The health facility assessment is also providing, if it provides information. Then we also conduct weekly event log calls. Our data officers call all the facilities because we want to have an idea of the frequency of the power outages. Then the neonatal inpatient data also helps us to show which equipment is not working because of power supply. Then hard monitors also have been installed. We are still in the process of installing them. That also helps to provide the information in terms of usage of that equipment, but also the power outage. And this information is becoming very powerful for lobbying for support within the facility, as well as maybe reaching out to partners and donors. Next. So I wanted us to also just have a look at some of the reports that we can produce using this information that we are assessing. So this is one of the facilities. So before I go to this information on this slide, what I wanted to share is we collect this power outage information at different intervals. So we have information of power outages which last for 1 to 2 minutes, 3 to 5 minutes, 6 to 10 minutes, then above 10 minutes. So I thought in this presentation, I should just share the power backup outage for those episodes which were more than 10 minutes. So you can see this is from June 2023 to May 2024. There's no month where they did not have a power outage. And this, we are talking of more than 10 minutes, which shows that we keep on losing babies because of the power outages that we could have saved. Next slide. So what is it that we are learning from this intermittent power supply? What we have seen is nurses, they become reluctant to use some of the equipment, especially the CPAP equipment, because it takes a lot of effort to put a baby on a CPAP. And in a busy environment where the workload is also high, you don't want to be repeating the same activity process now and again. So you find that if the first time they put the baby on the CPAP and the power goes out, they remove the CPAP machine. When the power comes back, it takes a long time for the nurse to go back to that same patient, same baby, to put up the CPAP machine. There's also high risk of damage to the equipment due to the voltage spikes. And also the equipment, we end up not using the equipment to the intended purposes. For radiant warmers, you are supposed to provide warmth, but they will end up being used as just baby cots. Then also to keep the temperature warm in the nursery, you need the power for the heaters. So this also complicates the already existing problem of hypothermia in our newborns. Then also there's the low involvement of management in data usage. I can give an example here of a facility that we visited during QI visits. So during the visits, we have a number of tracks that we follow. So this one was on leadership and governance. So we needed to meet the management. And usually the administrators are deciding factors in terms of how to use money at the facility. So we were discussing with him about the challenges of power delays in putting up the backup power in the nursery. So this administrator commented that, you know, last time when you came, you told us we needed to ensure there's a backup power in the nursery, and we bought a genset. And the genset is there just for the nursery. And we make sure at least if there's a power blackout, within 40 minutes, the backup power should be up and running. So we asked him, do you know that in the nursery, there are a number of equipment that are there to help the babies breathe and they need the power? He said, yes. So we asked him, can you stay 40 minutes without breathing? We could see from the facial expression that it was an eye-opener. And he responded that, you know what, I think we as administrators, we really need to be part and parcel of these discussions, because sometimes we don't know the impact of some of the decisions that we make. So this could be one of the things that we really need to focus on as we continue supporting these facilities. Next slide, please. So what is the way forward? I think we really need to invest more in solar system. And the Patriarch, I think, will help us on how best we can do it, because most of the solar system that we are using doesn't last long, and also it doesn't provide power to a number of equipment. So we need something which has better batteries and proper load sizing. Then we also need to have a system where the power can be connected automatically, rather than this manual way of connecting when there's a power blackout. Then also the high voltage monitors, if they could be installed to all the equipment that we will need power throughout for them to function, so that at least we are able to track power outages as well as device usage. And then the other important aspect is to use the data which we are correcting in terms of the assessments that we are using. This is the first time I think the management have access to the information on the impact of the power outages that we face in the country. So this is a powerful tool that we have to use within the facility, discuss with the management. I'm sure they can be able to spare some money to provide fuel for the gensets. But we need that information also to lobby with other stakeholders and the donors so that they can come in and help. Otherwise, we might provide the quality care, but if the power keeps on going down, then we will be moving one step forward and one step backward. Thank you. Over to you, Millicent.
Wow, well done. Thank you so much, Evelyn, for that wonderful presentation, including asking the administrator to hold her breath for 40 minutes so that, it's amazing to see what work Malawi team is doing over there. So we're going to have our next presenter, that is Alexia Marcus. Alexia is going to take us through accurate measuring of power outages using Hadley device, data or monitoring system. Alexia is a data scientist and systems architect at Thirdstone Design. She works in the customer experience for Hadley Health Technologies section. Alexia also leads software and hardware development at Thirdstone. And Alexia coordinates the Hadley system deployment and customer training for the Hadley monitoring system. Allow me to welcome Alexia to tell us what this Hadley monitoring system is all about and how we can all gain and learn from it. Welcome, Alexia. Thank you.
Thank you so much, Millicent. I'm happy to be here with you all today. And as a registered nurse myself, I can completely empathize with all the situations Evelyn was describing. So next slide, please. I'd love to tell you about the Hadley monitoring system. So any good system addresses a problem. And I think we've been all talking about this as big problem, but I'd like to address the problem of tracking the power outages. As you saw, the Nested team and the data officers through the NEST program are doing a fabulous job monitoring their power outages. However, it's being done manually because they're until Hadley's installed, there's no system to do that. And as we know, it's not as efficient and effective as it could be because it introduces a greater resource load on the valuable resources, people working in the facility. And it's just really difficult to do manually compared to an automated system. And that's where Hadley comes in, where the electricity in the ward is automatically monitored. And this provides the information needed to help ensure the medical devices are available when needed. But specifically, I want to focus on the accuracy that a system can do that as opposed to a manual system. And then that reduces the demands on the resources at the facility, which could be targeted elsewhere. So next slide, please. So when I look at what logging before the system installation looks like, so we have to rely on this manual capture of power outages, and specifically we can capture outages, but brownouts and surges are really hard to track. They're usually invisible and can't be detected. And as a nurse myself, I'm very familiar with these manual logs, especially in high turnover areas like a pediatric ward, newborn ward. It's difficult to train everyone to do this properly. You oftentimes have incomplete entries. Sometimes it's hard to read the writing. But obviously it's better than nothing, and this information has to be tracked. But a solution that Hadley provides is after installation, not only is the power quality visible, the data gathered then makes it possible to assess the effect on the equipment and the interruption of patient care. So we can see here, there's a chart that shows the voltage coming into the ward is sometimes thrashing around a low threshold, and that can be damaging to the medical devices there and interrupt patient care. Next slide, please. So an overview of how the system works is it identifies with a monitor on the back of each medical device whether the device is on or off, so whether it's running or not. It also captures the temperature and humidity in the ward. and it captures the power level that's available in the ward. And it aggregates all of this data into usable information for biomedical technicians, distributors, and facility administrators. So all of these monitors are placed around in the neonatal wards, and then they're all fed into this system in this dashboard. Next slide, please. And just wanted to show you, rather than talking conceptually, what does it actually look like? So here we can see the monitors are on the back of devices, and we can monitor any device that runs on power that needs to be plugged in. So there's a monitor on the back of an oxygen concentrator on the top left. In the middle, it's on the back of a warmer. On the top right, it's on the foot of a phototherapy machine. And then in the bottom photo, we see our gateway, which collects all of the data. And then there's our voltage monitor that's plugged into the power coming into the ward. Next slide, please. So once we've started capturing all this data, we then display it on a dashboard. And this dashboard is used to help identify medical devices that need maintenance, and also specifically identify any environmental factors that could affect utilization of the devices. And the goal is really to make sure the medical devices are working properly, including having power when they're needed. So we can see on the screenshot here, we show a device status of the number of devices monitored. We'll show the number that have been off for at least 7 days. And in a typical ward, and even with preventative maintenance protocols, every device should be on at least once every 7 days. So if it's not been on in 7 days, that could highlight a problem with the device. So we're helping to prioritize the devices that the biomed technicians should look into. And then on the top right, we show the environment status. And in this case, there were 8 power outage events, which could affect how the devices are utilized. No temperature events, those were within normal limits, and same with the humidity. And then down below that, we show a heat map that shows with a color-coded value how many hours on per day a device was used. So we can see very quickly any impacts that power outages or environmental factors could have on how much the devices can be used. Next slide, please. So as far as our rollout, this product was built for the NEST 360 program. So we started in the NEST countries of Kenya, Malawi, Nigeria, and Tanzania in 2022. We installed in 23 facilities, and we had 371 monitored devices. This year, we'll expand into a 5th country to include Ethiopia. We'll be in 114 facilities, and we'll monitor over 2,500 devices. Next slide, please. So how do we measure power quality? We have a voltage monitor in the system that's installed in the ward where the monitored devices are running. And this monitor, this data captures the voltage that's available in the ward. So exactly how many volts are coming through the outlets in the ward. And just want to point out that here we're showing a particular type of plug, but this plug can be modified and customized to any plug type that's in the ward. Next slide, please. So once we have this monitor installed, we can set thresholds that define a spike, and that'll be greater than 265 volts, a brownout that'll be less than 200 volts, and an outage, which will be no volts at all. So we're looking at plus or minus 10% of what the devices expect based on the manufacturer's design of those devices. So these devices are designed to run at a very specific power level. And when they have too much power and not enough power, that can damage the device. And again, in this facility 1, we're seeing that usually the power level is between the thresholds, but it's also has a lot of variability. It's not very steady, and it can tend to dip below the manufacturer's recommendation, kind of thrash around there, which is not very good for electrical equipment. Next slide, please. What's really interesting about getting to see this data is we see that the power quality really differs among facilities, and these are all in the same country. It shows that specifically, so you can see the variability. In facility 2, this is really interesting because we can see their power is available. It's always above 0, but it's always below the expected level that the device needs to run properly. And this is not something you can detect with manual logging and tracking efforts, because this is just invisible. So this is also something that will damage the devices over time. So we can see that there's variability, and also it's always below the level that the device needs. At facility 3, we can see that we have power within the bands, but early in the graph, we can see it's constantly dropping down to 0. So we have many power outages happening in a very short period of time. And then it comes back up to the normal range. Then again, it's thrashing around this lower band, giving the device not as much power as it should have to stay running. And then as we go further to the right on the graph, we see the power just drop, hover just above 0, and then kind of flatline for a long amount of time, and then come back and get up to this variable pattern again. So quite a different profile among these different facilities. And on the next slide, I'll show you another facility that's having a real issue with outages completely. So what's interesting is we can see that the power quality is actually quite good when we're in the normal threshold, the band of those thresholds, but we have a lot of drops down to 0. And as Evelyn described, these are these very significant events that really interrupt patient care, where nurses are just not going to be wanting to put a baby on CPAP when the power is out. That's essentially like blocking the nasal passages, and the baby just needs CPAP to breathe, does not have that therapy. But this variability of the outages is really going to dissuade the nurses from even putting a baby on CPAP, because the thought of taking it on and putting it off is just too labor intensive. And just to show that for all of the events, the charts that I'm showing on the dashboard, we list all the events in a table, and as you can see, the power event durations are quite significant, many times over an hour or multiple hours. And just to point out, we do allow exporting this data, but really what we're seeing with these data sets, the real value is we have accurate measurement of the power values. So as Millicent and Evelyn said, this is what's going to allow for advocating for the investment in a solar system, as Patrick described, backup generators, when they need to be available, by having an accurate quantification of not only the number of power outages, but the degree of the variability of the power. That will really allow to have this data-driven decision-making around what types of systems are needed to invest in. Another key point is that this will also provide the data to show the effectiveness of those interventions. So after investment has been made, you can show a before and after picture of how the power quality is improved with the intervention. And that's something that certainly a donor that invested in a solar system is going to want to see. But it also will help the local facility staff monitor that intervention and make sure that there's enough power available, that the quality is good, that the solar system is being maintained, that the generator is available when it needs to be. So it will continue to provide that value even after the investment has been made in the power quality intervention, either a solar system or another generator. So that's it for me, and thank you so much.
Thank you so much, Alexia, for taking us through that. Indeed, we have learned that it's not only the reliability of power, but also the quality of power is really, really important when it comes to our devices' functionality, and also in ensuring that we don't have breakdown of devices due to power spikes. At this juncture, Alexia, thank you so much. And I'll just bring you back to Scott to just let us know how can the low and middle income countries get this hardly monitoring system to be able to monitor and have evidence-based data to buy some of the alternative power supply sources that are there? Over to you, Alexia.
Thank you so much, Millicent. Well, certainly if the facility is part of the NEST program, the plan is to be able to monitor all devices in all facilities in the NEST program. For facilities and organizations outside of the NEST program, they're welcome to contact me directly. I think my contact information can be shared with this presentation. You can also email info@hadleyhealthtechnologies.com, and I'd be happy to receive any inquiries there. Thank you.
Thank you so much. Thank you so much for that. At this moment, allow me to hand it over to Prof. Joy to give the closing remarks. And thank you so much, everyone, for listening. And we believe that we are going to have a call to action to ensure that power is available for our newborn units. Thank you. Over to you, Joy.
Thank you. Millie has a very powerful woman and engineer. We're really grateful to you for hosting and grateful to the real depth and breadth of people who have spoken. Always learn so much from engineers, right? They dissect and find solutions. So maybe just a couple of highlights. I think we're talking about where is the power, and what we recognize is newborns are especially vulnerable to power outages. They don't have voices. And often the caregivers don't have voices as well. So I particularly want to salute Evelyn for the really innovative way of getting the person in power to think about the consequences for the baby. So yes, we need to have data and use that, but we can also use approaches that bring the human side to the importance of this. Please do share these resources. The film will be available in English and in French, so share it on to others, and then think about how we do things to change the situation. So here on the implementation toolkit, we want to look at the problem, but we don't want to spend our time admiring the problem. We need to find ways forward. So reach out to find out about solar power, reach out to find out how to monitor your power coverage and quality and to change that. Think about how you can interact with your hospital administrators so that the newborn unit is protected. And then please do, if you have useful resources or ideas or ways that you have managed to solve these problems, please share them. We would love to have your tools and ideas on this topic. And then very excited to say that we have a number of really important webinars coming up. So we will have one on humanitarian situations. We will have new data from Gaza on the consequences on newborns. And this will be en français. So it will be in French, but translated to English for more equity. So please do join us for that. I think Lauren or Toby, you can post in the chat for when that is. And then we also have a very important one on nutrition and breast milk feeding and support at the time of World Breastfeeding Week, and a number of others coming up. We have recent ones that were filmed. So please share and also suggest your ideas. We'll have an upcoming essay being opened again soon. Really delighted that last year we had 28,000 users. This year we're on track to have more. So I want to thank all of you for joining, all of the fantastic speakers for their power. And a particular thank you to the Toolkit team who have put so much work in here, and Bozo, Lauren, the translation team who are fantastic, and Toby. So thank you all so much, and please share and join, and let's go faster together and bring power to what we do for newborns across the world. Thank you.